This morning we had a press conference at 9:30. Many people saw it. I was just looking at it earlier on CPAC. It came off very, very well. And there was already quite a few hundreds who had shared it. So that was really good. That's how things obviously work on social media. We share it and then it goes around. And so our speakers this morning were Dr. Peter Blusanovics and Dr. Paul Saba and myself. So we'll start with the three of us, and then we have several other speakers. And so Dr. Peter Blusanovics is he's from Montreal, and he's been working for 30 years as a physician and people with mental health issues, his primary area. So I'm going to have him speak first. So the purpose of this rally is twofold, as you see on your signs. We are mourning 100,000 deaths. So in Canada, now in April, sometime this month, we will surpass 100,000 deaths. That's significant. That's death out of control, killing out of control in our country. Now, if you can join us back here, it's better rather than being up front. The second thing is that obviously we're supporting Bill C-218, which will reverse the euthanasia for mental illness, which is scheduled for coming into place in Canada on March 17th, 2027. So, Dr. Peter, you're first.
Good. Is this my? Yeah. Oh, that would be wonderful. Pleasure to be here. Pleasure to give a voice to the cause. Pleasure to be here. Pleasure to give a voice towards the cause. My name is Dr. Peter Blusanovics. I'm a family physician who has been practicing for over 30 years. I have experienced helping patients in offices, emergency rooms, and in mental health institutions, and I have treated many with mental illnesses in these settings. And that's why I'm here today. I want to provide a voice for our most vulnerable, those who have and are suffering from mental health. Bill C-218 needs to pass to put a stop to euthanasia for people with mental illness. Basic needs are not currently being met in our healthcare system. Without this bill, we are condoning a bypass towards suicide and blatantly admitting defeat. Mental illness needs to be properly identified and treated. These individuals do not want to die, they want their sufferings to be relieved. But there is currently lack of medical support, such as physicians, psychologists, and social workers. There's a lack of access to psychiatric support and long waiting lists before being assessed. There's lack of financial support, lack of housing, lack of economic security, lack of family support, and from significant others. I will say it again, and I'm here to provide a voice for our most vulnerable. I know that offering medical aid in dying provides no solution. Everyone deserves the right to be treated with dignity and humanity. We are supposed to be a mature and evolved society that needs to take care of its most vulnerable. We need to realize that the lack of proper care in our healthcare systems is not a good enough excuse to offer assisted suicide as a solution. Bonjour, je m'appelle Dr. Peter Blusanovics. Je suis un médecin de famille de Montréal, où je travaille depuis 30 ans. J'ai eu l'occasion d'aider des patients en cabinet, aux urgences et dans les institutions de santé mentale. Et j'ai soigné de nombreuses personnes atteintes de troubles mentaux dans ces contextes. C'est pourquoi je suis ici aujourd'hui. Je souhaite faire entendre la voix de nos plus vulnérables, ceux qui souffrent ou ont souffert de troubles mentaux. Le projet de loi C-218 doit être adopté pour mettre fin à l'euthanasie des personnes atteintes de troubles mentaux. Les besoins fondamentaux ne sont actuellement pas satisfaits dans notre système de santé. Sans ce projet de loi, nous tolérons un contournement menant au suicide et admettons ouvertement notre échec. La maladie mentale doit être correctement identifiée et traitée. Ces personnes ne veulent pas mourir, elles veulent que leur souffrance soit soulagée. Mais il y a actuellement un manque de soutien médical, notamment médecins, psychologues, travailleurs sociaux. L'accès au soutien psychiatrique est limité et les listes d'atteintes sont longues. Il y a un manque de soutien financier, manque de logement, manque de sécurité économique, manque de soutien de la part de la famille et des proches. Je répète, je suis ici pour donner une voix aux plus vulnérables d'entre nous. Je sais que l'aide médicale à mourir n'apporte aucune solution. Tout le monde a le droit d'être traité avec dignité et humanité. Nous sommes censés être une société mature et évoluée qui se doit de prendre soin de ses membres les plus vulnérables. Nous devons prendre conscience que l'insuffisance des soins dans nos systèmes de santé ne constitue pas une excuse suffisante pour proposer le suicide assisté comme solution. Merci.
People only with a mental disorder will be euthanized next year, starting March 2027. This, despite the overwhelming evidence that people with mental disorders can be treated, and that most psychiatrists cannot determine which patient has an irremediable, that means irreversible and treatable condition. From a legal standpoint, those with mental disorders requesting what they call medical assistance in dying, really it's euthanasia, do not meet the condition of free and informed consent, because the desire to die is in most cases a symptom of mental illness. Bill C-218, which will be voted sometime in the near future, would stop euthanizing people with mental health disorders as the sole criteria. This bill must be supported by our members of parliament who actually value life. Don't let them fool you and say otherwise. This is not a merciful act of killing people who need help. Dans la plupart des cas, le désir de mourir est un symptôme de maladie mentale. 90% des personnes qui mettent fin à leur jour sont atteintes d'un problème de santé mentale au moment de leur suicide. La plupart des personnes qui ont tenté ou réussi à se suicider ne veulent pas mourir. Ils veulent plutôt échapper à leur détresse émotionnelle. Selon une étude de Harvard School of Public Health, 90% des personnes ayant tenté de suicider sans succès ne se sont pas suicidées après le traitement. Avec le bon traitement, le suicide a disparu. According to a Harvard School of Public Health study, 9 out of 10 people who attempted suicide but were unsuccessful. These were the survivors after their attempt. One of my patients, and let's call her Jody. She's an actual patient who I saw last week. She couldn't be here today. She asked me to tell her story. In her 20s, she was a mother of 3 small children. She was involved in an abusive relationship. To end her emotional distress, she attempted suicide by hanging. Her neighbor found her and removed the cord that was around her neck, saving her life. She told me if she had been euthanized, she wouldn't have survived, because euthanasia with a lethal injection is a guaranteed death sentence. There are no survivors. Today, she's in her 50s. She's happy to be alive. She ended up remarrying. She had another son, and today has 4 grandchildren that she enjoys. La plupart des personnes atteintes de troubles de santé mentaux ont besoin de soutien de psychiatres, de psychologues et travailleurs sociaux, qui sont rares dans notre système de santé. Beaucoup vivent dans des situations financières et sociales précaires. Ils ont besoin d'un soutien financier, notamment un logement abordable et d'une sécurité alimentaire. Au Québec, le délai moyen d'attente entre la référence à un psychiatre et le traitement est au moins 5 mois. In Quebec, the waiting time to see a psychiatrist after being referred is at least 5 months, and in many cases, much longer. If people are killed by law next year, they'll have a 3-month waiting time before the lethal injection is given. With an average 5-month waiting time to see a psychiatrist, it's likely that a person would get a call to see a psychiatrist 2 months or longer after having been legally injected. And as you well understand, that's of no help. In addition to psychiatrists, psychologists, social workers, we must ensure access to a wide variety of alternative treatments, including art, which Lisa will be speaking about in a little bit, music, dance, pet, recreation, massotherapy, which Stephanie will be talking about, and other therapies. We must also ensure free medications, affordable housing, and food security. A study published in Sage Journal last year of 2025 explored the potential cost savings to governments by expanding medical assisted dying to include vulnerable groups with mental illness. These groups included those with mental health issues, the homeless, drug users, retired elderly, and the indigenous communities. The estimated projected savings was $1.273, almost through $1.3 trillion between 2027 and 2047, with an estimated 2.6 million deaths in the voluntary groups, mostly mentally ill and elderly population. That translates to about 130,000 extra deaths a year. According to the authors of the journal, and these are not my words, quote, this cost-saving measure raises significant ethical questions. Financially incentivizing medical aid in dying could shift healthcare priorities away from providing necessary support, potentially devaluing vulnerable lives and fostering a troubling reliance on assisted death as an economic solution. So, according to them, the government is looking to save money and getting rid of people that they consider less valuable. Les personnes atteintes de problèmes de santé mentale ont besoin de soins, de traitements, de soutien et ne doivent pas être euthanasiées. Nos députés doivent voter en faveur du projet de loi C-218 et non pour l'euthanasie des personnes avec des problèmes de santé mentale.
Merci.
So I want to express our deepest sympathy to the families in Canada who've lost members of their families, friends who've been lost to euthanasia in Canada. This is a very sad milestone that we're surpassing 100,000 deaths in Canada since legalization. I remember Gaétan Barré, then the Quebec Health Minister, stating in 2014 during the debate, he said it'd be for extraordinary cases. Euthanasia now represents about 8% of all deaths in Quebec. Jocelyn Downey, a longtime euthanasia academic, told the Canadian Parliament's Special Joint Committee on Medical Assistance in Dying that is now studying euthanasia for mental illness alone, that Parliament must stick to the March 17th, 2027 timeline and permit euthanasia based on mental illness alone. Downey threatened the committee by stating, what will happen if there is an extension or exclusion is that people will die by suicide. Downey is saying that the answer to suicidal ideation is suicide. And people will die by suicide if they don't have access to euthanasia. The threat that people who are denied euthanasia will die by suicide is a false pressure tactic. The Supreme Court of Canada accepted the suicide argument in Carter when it struck down Canada's laws that protected people from being killed by euthanasia. But the Supreme Court was also wrong. I'm not a lawyer, so I can say that. If the premise that people will die by suicide if euthanasia is not available to them is correct, then the suicide rate should go down after euthanasia became an option for Canadians who were not terminally ill. According to the Government of Canada's suicide mortality stats, there were 3,978 recorded suicide deaths in 2016, the year we legalized euthanasia. In 2021, there were 3,927 recorded suicide deaths. That is the year that we expanded euthanasia to people who are not terminally ill. But in 2023, 2 years after extending euthanasia to people who are not terminally ill, there were 4,735 reported suicide deaths in Canada, representing a 20% increase in 2 years. I'm not arguing that Canada's increase in suicide death was directly related to Canada's euthanasia expansion, but I am saying that if Jocelyn Downey was correct, the suicide rate should have decreased, whereas in fact it has significantly increased. Health Canada released their 6th annual report on medical assistance in the dying last November 2025. That was for the 2024 stats. It indicated that we had a 6.9% growth in 2024 of euthanasia, and it said that we had about 16,499 reported deaths. That was up, as I say, from 15,427. Now, if you look at the 2025 data, now it's not been released by the federal government, but the Ontario data has been released. We had an increase of 7.3% in Ontario. We had an increase of 11% in Alberta. I predict that the 2025 increase is probably around 7%. That would put us at approximately 17,700. Now, obviously, that's just an approximate number. But when you start doing the math, obviously you understand how I come to the fact that this month represents us passing the 100,000 mark. Okay? Clearly, there's no indication, though, that this massive growth in Canadian euthanasia death has resulted in a lower rate of suicide. Never happened. Suicide rates do not decrease in jurisdictions where euthanasia has been legalized. So, first of all, it's interesting. In December 2020, Senator Kuchar said in committee, now that's when they were debating Bill C-7, the rain is not my friend, but anyway, he said in jurisdictions such as Belgium and the Netherlands where assisted death is legal, that the suicide rates have decreased. He then stated there's no link between assisted death and the rate of suicide in jurisdictions where it's legal. The problem with Senator Kuchar's statement in 2020 was that it was absolutely wrong. In the article, I sent him an article, and I wrote an article to him explaining that in no jurisdiction that's legalized euthanasia or assisted suicide, that over a long period of time, they've experienced a decrease in suicide deaths. There's no jurisdiction, not one. In fact, in February 2022, bioethicist David Albert Jones published an article titled, "In Europe, Suicides Rise After Right to Die is Legalized." Jones provided a comparison between European nations that have legalized as compared to ones who have not legalized, and he has showed that in nations that had legalized euthanasia, the suicide rate was going up in comparison to those nations where, in fact, in general, at that time, suicide rates were going down in Europe. So almost every nation that had not legalized, their suicide rates went down, and in almost every nation that had legalized, suicide rates went up. Now that's not a direct correlation, but it shows you that legalizing euthanasia did not decrease suicide in any jurisdiction. In other words, Downey is using a false argument to scaremonger members of Parliament into approving euthanasia for mental illness alone. Downey uses court decisions to uphold the position of the justices that are not, and they're not suicide prevention experts. They're not like Dr. Peter, who's worked for 30 years in the field. They have no idea compared to that. Minimally speaking, legalizing euthanasia does not lead to a decrease in suicide rates, and the data suggests that legalizing euthanasia actually has a suicide contagion effect, leading to long-term higher suicide rates. In other words, Downey is wrong. Anyway, we are mourning 100,000 euthanasia deaths in Canada since legalization, and we're challenging the federal government not to expand Canada's euthanasia law, but to launch a study done by neutral researchers, if you can find them, on the effect of Canada's out-of-control euthanasia regime. Thank you very much.
Hear, hear.
So we have Tamara Jansen with us in the rain. I know there's other speakers here, but she gets priority now that she's here. And I'll need, very good. And I'll need someone to hold her umbrella. Very good, because we don't want her getting soaked. And she's got notes too, in the rain. So Tamara Jansen is the sponsor, as you know, of Bill C-218. And she's one of the primary reasons why we're here today in the rain. So thank her about the rain later.
Yeah, I'm sorry about the rain. I didn't expect it myself, but here we go. We can't do that good of a planning. But anyways, my friends, you know, when I first got involved in politics, it wasn't because I thought I had some grand plan to stand on Parliament Hill one day and speak about a bill like this. It started a lot more simple. I got to know my local MP, Mark Warawa, and I loved what he stood for. I started helping him organize town halls, meet with people in the community, and make connections. He was doing all this because he was passionate about the vulnerable citizens among us. And one of the things that Mark cared deeply about was palliative care. He believed in a very real and practical way that when people are suffering, our job is to come alongside them, to care for them, to support them, to remind them that they're not alone. Now, Mark also served on the original committee studying what would become MAID. And I remember him saying more than once that we needed to be very careful, because once you open a door like that, you don't always get to decide how far it swings. At the time, some people thought that was a bit of a stretch, but I don't think anyone would say that today. Because here we are, just a few years later, and what began as something quite limited has been expanded, piece by piece, to the point where we're now planning to offer MAID to those whose only condition is a mental illness, people who are not at the end of their life. And somewhere along the way, I find myself thinking, this isn't what people thought they were agreeing to. That's why I brought forward Bill C-218, building off the work of my colleague Ed Fast. Because at some point, when you can see where a road is leading, you have to be willing to stop and say, let's take another look at this before we go any further. Now, when you take the time to really look at what's being proposed here, and you listen carefully to the people who are working most closely with those who are suffering, you begin to understand that this issue is far more complex than it is often presented by organizations like Dying with Dignity. We've heard from psychiatrists across this country, highly trained, deeply experienced professionals who are telling us quite plainly that when it comes to mental illness, there is no reliable way to determine that a condition is truly irremediable. That word matters because it's the very foundation upon which MAID rests. It assumes that we can identify with confidence when suffering cannot be alleviated. But in the case of mental illness, the evidence simply does not support that level of certainty, and the doctors themselves are telling us so. And if we pause for a moment and reflect on that, it raises a very serious concern, because what we're being asked to accept is not a clear medical conclusion, but a judgment, one that carries permanent consequences. Mental illness does not follow a straight line. It shifts, it responds, it improves, sometimes in ways that even surprise those who spent years studying it. People who once believed they could not go on have, with time and care, found their footing again. And yet, under this expansion, we are being asked to make life-ending decisions with no clear certainty that things couldn't improve with time and care. But there's another piece of this that Canadians often don't realize. Under the current framework, there is no requirement that a person must have received every reasonable treatment or even meaningful treatment at all before being approved for MAID. Just think about that for a moment. We are prepared to offer a permanent solution even in situations where the path to care has not been fully pursued, or where access to that care may have been limited in the first place. And when you place that reality alongside the circumstances many people are living in, it becomes much more serious, because vulnerability is not just about a diagnosis. It's about the whole situation a person finds themselves in. It's about someone who feels isolated, someone who feels like a burden on their family, someone who looks around and quietly begins to wonder whether others might be better off without them. Those are not rare thoughts in moments of deep struggle. They are, in fact, painfully common. So we have to ask ourselves, what happens when a person in that state is presented with MAID as an option? Are they making a free and fully unburdened choice? Or are they responding to a set of pressures, emotional, social, even financial, that are shaping that decision in ways we cannot measure? At the same time, experts who have spoken to us have raised another concern, one that is difficult to ignore. They're seeing individuals who are already struggling with suicidal thoughts becoming aware that there is now a system that can provide the outcome they want. And in some cases, when one door closes, another can be found. Because what has emerged is a form of doctor shopping, where individuals seek out assessors who are willing to say yes, even when others have urged caution or continued care. Some experts have described this as creating a kind of a pull, where MAID begins to appear not as a last resort after every avenue has been exhausted, but as an available alternative. We've already seen the consequences of that in Keanu's story, and many of you here have known him. He was a young man who was struggling, who needed support, who needed time, and whose mother fought for him. She fought the system for him because she believed, as any parent does, that her son's life was worth fighting for. And yet, despite those efforts, he was eventually able to find a pathway that led to his death. How many more Keanus are out there that we haven't heard about? And that's where this becomes more than policy. Because when a system allows that kind of outcome, it raises a very serious question about whether we're truly protecting the vulnerable, or whether we're making it easier for them to give up at the very moment they most need someone to stand in the gap for them. And so I want to close by simply saying thank you. Thank you to every one of you who has taken the time here to stand here today, and to so many others across this country who may not be on this hill, but who have picked up the phone, written an email, or had a conversation with their member of parliament, because they know this matters. These things aren't always easy to do. They take time, they take courage, and they come from a place of deep concern, not just for ourselves, but for people we may never meet. And that, more than anything, is what this bill represents. It represents a decision as a country to stand with those who are struggling, especially when they cannot stand on their own. It represents a belief that vulnerability should never become a pathway to being overlooked, or worse, to being offered something final when what is still needed is care, time, and hope. And I want you to know that your voices are being heard. In Parliament, those calls, those letters, those conversations, they matter. They shape decisions, they influence outcomes. They are reminding every member of Parliament that behind every vote are real people, real families, and real lives. So please, keep going. Keep speaking. Keep standing for those who need someone to stand for them. Together, we will reaffirm the kind of country we want to be, one that truly cares for those most vulnerable in the communities across Canada. Thank you.
Thank you so much, Tamara. Thank you. Kathy Matusiak from Compassionate Community Care. And so Kathy, can you speak for like 5? Is it good? Very good. And now Compassionate Community Care is an organization that provides, Tamara's here if you want to say hi to her, but obviously we want you listening if you can. Compassionate Community Care is an organization that provides training and help to people visiting, etc. So, Kathy.
Thank you, Alex. And Ms. Jensen, thank you for being here for everyone. Can you hear me all right?
Yes.
Okay. Thank you. Thank you. I'm here on behalf of our charity, Compassionate Community Care, which specializes in assisting Canadians across our good nation with issues related to end-of-life crisis, advocacy-related issues, and any questions or concerns related to euthanasia and MAID, or medical assistance in dying. We provide a free 24-hour helpline 7 days a week, on which we receive calls daily on cases which you've heard today described to you, and testimonies from people who are either considering euthanasia or are booked to die by MAID. Canadians, I can attest, feel the pressure to choose MAID because of lack of hope, despair, loneliness, and their fear of suffering. These are normal considerations and situations that people face when pressed with end of life or a health challenge. We've had cases of people not being offered treatment for a toe infection and instead being referred and then approved died by MAID. I've heard first-hand witnessed cases of a grandparent just recently, a grandmother diagnosed with sepsis on Tuesday, booked to die by Friday. Thankfully, because of our involvement and consultations with a direct member of her family, and due to the strong relationships around her, especially that of her granddaughter, simply one or two people sharing how much she means to them changed her mind. The same grandmother ended up dying naturally the day after she was booked for MAID on the Saturday afternoon. We later found out that a family tied to this grandmother had been present at a MAID death of someone in the family not too long before this situation arose. She said and recalls that it is a barbaric practice that should have never been allowed. People need care and compassion, not a lethal injection. Canadians need better health care, not death management. Knowing that we have surpassed over 100,000 cases of this in our medical system, dying in Canada is a tragedy, to say the least. And now, sitting on our heels is the entry of mental health illness as a single condition for eligibility for medical assistance in dying, slated for March 2027. In less than a year from today, the floodgates will open, and not only will there be a tidal wave of mental health cases eligible solely for MAID, but this will invoke a parallel catastrophe in the mental health sector wherein therapists, mental health counselors, psychotherapists, and the like will be forced into a situation where they will have to effectively refer or approve euthanasia of their patients. We're seeing it already. Cases of MAID for mental health have already started and are running through the gaps of the system. Christopher Leon witnessed his father's MAID death be approved while being allowed to drink and be intoxicated. We see the case of Keanu, mentioned sadly today, again, as he died just before New Year's Eve. This past New Year's, Keanu traveled to get euthanized. He was a young 26-year-old man facing no terminal illness, only seasonal depression, and had blindness due to diabetes. His depression, which was relieved with the help of a caring, compassionate family, the community that rallied around him, he instead chose to travel to BC and be killed by one of Canada's infamous death doctors. The eligibility criteria has been completely engulfed by those who are stuck between a hard place and an open door to death. Canada needs a complete overhaul of its medical assistance and dying regime, and it's only a review, that is not only a review, but a halt of the system. The system has failed Canadians across our nation. We get flooded with calls from individuals who are scared to die in a hospital and are looking for safeguards because they don't want to be approached by MAID. Another call came in last week from a lady in Western Canada who, when she went to a local area hospital, was offered MAID 3 times for back pain. She walked out without any treatment, was threatened, and no luck and no support for her back. But she was told she can always come back and get euthanized. This is atrocious. I worry for the future of Canada when our children are no longer ours since they meet the eligibility criteria. As young Keanu's mom, Margaret, told me at his funeral, your children are not your own once they reach the age of consent. They belong to the government. Okay. We have also recently started, in the last year and a half, a free seniors calling program, which is spreading like wildfire across Canada. We are offering free calls to seniors, anyone 55 and over, to receive safe, reliable, and consistent calls from a vetted, safe, trained volunteer caller. We have offered this service, and it is free of charge. We have ongoing trainings to help you build communities of care. that provide compassionate visiting support for free in your own community. Please contact us if you'd like to have a training in your neighborhood, or join us this week on Wednesday and Thursday night, where Alex and I will share you with our breadth of knowledge and expertise. We need better than euthanasia and medical assistance in dying. We need hope. Please be part of that solution and support real care. We need a culture that cares. Being there truly means being present. When people are there, they make a difference. Thank you.
So Kathy was referring to the visitor training sessions that we're doing this Wednesday and Thursday. So if you're on my email list, you'll get a promo about that probably tomorrow, and hopefully you sign up. So we have Nathan? Daniel Zekveld from ARPA will give a short talk also, and they're doing incredible work promoting Bill C-218 and many other things.
Well, let me start with a question. Is Canada a country that prevents suicide or enables it? Some parliamentarians seem to be unsure because they're about to offer assisted suicide to those with mental illness. In 2023 and again in 2024, our government acknowledged this. Canada is not ready to euthanize the mentally ill. But here we are again in 2026. The problems haven't disappeared. Recurring questions have not been resolved. So this time, let's get it right. Canada will never be ready to euthanize the mentally ill. Such an expansion normalizes death as a supposed solution for mental illness. It tells people that their life is not worth living. It undermines suicide prevention efforts, and it encourages despair for those who are suffering. The world is seeing the problems with euthanasia because of Canada's example. Quebec has prohibited MAID for mental illness. Alberta is about to ban MAID for mental illness. The United Nations, the Committee on the Rights of Persons with Disability, condemned Canada's euthanasia regime. They didn't just condemn the prospect of MAID for mental illness, but also Track 2 MAID, or euthanasia for people who are not dying. Other countries look at Canada as a warning against euthanasia, what not to do. The Scottish Parliament just defeated a euthanasia bill. Another bill in England will likely fail in the House of Lords. And yet, our government still plans to extend MAID to mental illness on March 17, 2027, less than a year away. We know where this can lead. The Netherlands legalized psychiatric euthanasia in 2002. For a decade, they had only 1 or 2 deaths per year due to psychiatric euthanasia. But in 2024, there were 219. Rapid growth in that country. Euthanasia for mental illness simply gives people an effective way to commit suicide, and that's something that we need to prevent. We support Bill C-218 because Canadians with mental illness do not need help to die. They need help to live well. They need care. They need support. Parliament must pass Bill C-218. But it also shouldn't stop there. Did you know that euthanasia for mental illness is already happening in Canada? It is, just for people with mental illness and a physical disability. Already, nearly half of all Canadians who die by MAID believe they're a burden on family, friends, or caregivers. Over 20% suffer from isolation or loneliness. Those aren't medical conditions. Those are social challenges that require care and support. Canada needs to promote suicide prevention for all, life-affirming care for all. Not just the mentally well, not just the able-bodied, not just those with years left to live. Canada must promote care for those in need, not end the lives of those who suffer. Canada's approach right now is rapid expansion, vague laws, and little oversight of doctors. And that's why Canada has reached 100,000 euthanasia deaths in just 10 years. Slowing that expansion starts right now. It starts with supporting Bill C-218. It starts with supporting Canadians with mental illness. So let's continue to raise awareness about this expansion, talk to our members of parliament, and call on them to stop euthanasia for those with mental illness and support Bill C-218. Thank you.
Thank you very much, Daniel. So, Garnett Genuis, the member of parliament from Alberta, was wanting to be here, but instead he has sent one of his staff members to be here, and he's going to give us a short introduction to a bill that Garnett is working on.
Hello, everyone. My name is James. As Alex mentioned, I work for MP Genuis. MP Genuis would have loved to have been here, and I'm sure he would have been really moved to see so many people show up, despite the weather. I just want to share a couple words about private member's bill that he has tabled in Parliament, which is Bill C-260. C-260 has a very specific focus, and it's targeting maid coercion. So the issue of people being encouraged to pursue maid as an option while trying to seek other alternatives, other alternative kinds of care and support. We have a website that you can visit, which is carenotcoercion.ca. There's a petition there that you can sign, but we also have some folks going around today with petitions that you can sign, and hopefully you will. It's a very specific scope that this bill has, and so we've kind of tailored it to be as passable as possible in the current political climate. This is an issue that people have spoken out in parliamentary committee about. The issues with folks in the disabilities community who are being encouraged to pursue MAID as an alternative to supports that they offered by people in those positions of trust and authority, but also the elderly, veterans. There are numerous instances of this, as well as stories that have been published. So I'd encourage you to visit carenotcoercion.ca to take a look at that. Encourage your members of parliament to support this bill, and hopefully we'll see multiple bills being passed in this parliament that will address the issue of MAID and the expansion. Thank you very much.
So we have a few more speakers now. Just so you know, next month is the March for Life on May 14th. So if all of you can be back here on May 14th, we have a speaker from Slovenia. His name is Aleš, and he was the one who was successful in overturning their assisted suicide law in Slovenia. Because last year in July, they had passed a bill in Slovenia to legalize assisted suicide, and then he organized a referendum campaign. So last November, I'm trying to remember the date, it was November 23rd, I think, but I don't have it in front of my face right now. But anyway, they had a vote, and they overturned that law by a 53.5% vote. So they went to the people and they overturned it, but it was Aleš who organized that campaign. He'll be here speaking on May 14th. He's a bit of a hero to many of us because he went out and did what had to be done, and it's important to hear how he did it. The next speaker from CitizenGO, well, CitizenGO has been involved with helping people do petitions, and I think it's very important that they exist for that.
Hello everyone, thank you so much for joining us, especially on this very rainy day. My name is Gregory Tomchyshyn. I am the campaigns director for CitizenGO. At CitizenGO, we're a global community of millions of citizens who share a single unwavering mission to defend life, family, and freedom. We believe in the sanctity of human life and stand as a voice for the vulnerable from the moment of conception until natural death, both here in Canada and around the world. I am here today because life is under a direct and unprecedented attack by our own federal government. In March 2027, Canada is scheduled to automatically expand medical assistance in dying, MAID, aka assisted suicide, to include individuals whose sole underlying condition is mental illness. This means that instead of offering intensive care, time, and support to those in their darkest hours, the state will offer them a lethal injection. This is not healthcare. This is the ultimate form of government neglect and social abandonment. We must recognize what is truly at stake here. This is not just another policy shift. It is the continued building of a culture of death. In this culture, human life is no longer cherished as the profound miracle it is. Every single one of us is a miracle. Dignity and value that isn't devalued because someone is suffering someone is suffering physical, mentally, or emotionally. And there goes my phone. Windy too. Okay, so.
Still recording.
Great. The fact that you exist is a gift that should be protected at all costs. But when the government and our healthcare systems begin to treat death as a solution to suffering, including psychiatric conditions, we stop seeing others as precious, unique, one-of-a-kind individuals. We start measuring human value by utility or the absence of pain. If we allow this expansion, it is a direct path to a society where child euthanasia, infant euthanasia, and euthanasia on demand for any reason at all will quickly become the norm. If the state can justify killing a citizen who is struggling with depression, where does the so-called choice to die end? The world is watching us, and they are horrified. The United Nations has already called on Canada to halt these expansions. But there is a path back to compassion. As we heard, Conservative MP Tamara Jansen is working on and introduced Bill C-218, the Right to Recover Act. This crucial legislation would permanently stop the 2027 expansion and ensure that mental illness can never be used as a standalone reason for assisted suicide in Canada. Provinces like Alberta have even introduced their own legislation to block this federal overreach and protect their citizens from this policy of despair. And Canadians are rising up to defend the miracle of life. At CitizenGO, we have already gathered 437 signatures on our petition demanding that our elected members of parliament pass the right to recover. I am asking you to act right now. Go to citizengo.org, add your name to Demand the Right to Recover, Stop Euthanasia for Mental Illness, and send a direct message to our elected leaders. Pass Bill C-218. Give all Canadians the right to recover. Let's choose life. Thank you.
Brandan from Campaign Life Coalition is next. I will hold that for you, Brandan. I'll take your sign. Or you can, you're using the sign as a backdrop. Fine.
Friends and fellow Canadians, in the depths of a battle with mental illness, the hope of recovery is a real and live possibility for everyone. Bill C-218, the Right to Recover Act, is a defense of the most vulnerable among us. If parliamentarians do not act by March 2027, seeking support in a mental health crisis will no longer be a cry for help, but a clinical factor for MAID assessment and an illness for which the prescription is state-facilitated death. As a country, we heavily invest in suicide prevention, training professionals to pull people back from the brink. But with the scheduled 2027 expansion of MAID, the government is preparing to offer those same people death rather than hope. As a Christian, I believe that every human life is a sacred gift from our Creator. Amen. Made in His image, our worth is not a result of our health or our autonomy. It is an inherent dignity that remains absolute, even in seasons of mental distress or deep loneliness and isolation. Our faith is hollow if not expressed through tangible action for those in need. As Canadians, we sing a national anthem where we ask God to keep our land glorious and free. But true liberty is not the power to do whatever it is that we want. It is the right to be able to do that which we ought. And that which we ought to do is to provide care for the sick and support for the isolated, rather than killing them with lethal injection. We are told that safeguards will protect the vulnerable, but the evidence a system already in crisis. Consider the tragic accounts recently shared by our parliament, in our parliament, by MP Tamara Jansen. Bill, whose medical team said he lacked the capacity to make major decisions, was shook away, sedated. A faint motion of his lips was interpreted as consent to end his life the very same day. Margaret explicitly requested palliative care, yet because she could not access a hospice bed and her caregiver was exhausted, she was pushed through a same-day assessment for MAID. A grandmother named Alice living with dementia was approved for death based on minimal paperwork and no clear expression of her own wishes. If our system cannot protect those with physical ailments, how can we trust it to protect those whose illness, by its very nature, clouds their judgment and hope? It is a national shame that we currently protect a person's bank account with more rigor than we use to protect that same person's life. The medical community is sounding the alarm. Psychiatrists from every medical school in Canada have clearly stated that there is no scientific way to predict if a mental illness is truly irremediable. Because recovery is common and unpredictable, we must never treat a dark season of the soul as a terminal diagnosis. You here are part of a majority in this concern. 70% of Canadians are uneasy with the expansion of MAID, and over 80% believe that we should prioritize mental health care over the provision of death. We stand here now to call on our political leaders to offer help and hope, not harm and death. We demand a Canada that invests in care rather than more vials of lethal injection. I urge you, my fellow Canadians, to stand on guard for the vulnerable. Contact your Member of Parliament today and insist that he or she support Bill C-218, the right to recover. Remind our leaders that a strong nation does not turn its back on those who suffer, but gives them the time, the care, and the compassion they need to heal. We stand here today in the rain to offer hope, to affirm the right to recover, and to defend the vulnerable and to choose life. Thank you.
So Dr. Saba was speaking about alternatives, and one of the people who is going to share some information about alternatives is Lisa.
Thank you. So my name is Lisa Hanash. I'm from Montreal, and so I'm currently working as an employee for doctor here as a medical assistant, and so I've firsthand seen a lot of the needs that come through the door. And hey, closer. Okay. So currently that is my profession, but on what I've been doing for many years, over 10 years now, is using art as a means of my own expression and alternative to therapies that are maybe more in the line of paying professionals, but in the way that it's a free resource for people to experience the expression that they see around them, which is the creativity, the God-given gifts that are around when we look around in nature, and to absorb them and be able to recreate something that will again bring hope and inspire and ignite the fire that is in each one of us, which is the light of Christ. And I believe that there is something inside of each one of you that has something to carry, that it is important and valuable and unique, and is in part of your DNA to contribute in a global society and also in a local community. And so I'm thankful for the gift that is life and that we are alive. And this is a thing that we want to sustain for as long as it's natural. And so that is why we have doctors who are in line with the truth of of keeping a dignified life. That I say that word like tread lightly on that word, because it's been used to misquote or be interpreted as a way of pride, and that pride comes before fall. So I want to remind ourselves that in the humility we serve, and to come along and be present with other people in their grief, in their trials, in their suffering, and the torment. Sometimes it literally feels like torment, and it can be exhausting and tiring and burdensome, yet there is hope, there is light, and that is, I believe, in the one God, in Christ, who gives us that hope. And so I, as an artist, want to compel those images and visuals to people to see as ways of reminders to keep going, to keep pressing through. And this is something that I am grateful for and want to continue doing alongside friends. And so I'm going to also pass the mic to a friend.
So Lisa was talking about the importance of art therapy. There's many things like that: art therapy, music therapy. And Stephanie,
Thank you. My name is Stephanie Colmar. 16 years ago, my husband committed suicide. And I would have imagined that 16 years in advance, this is not where healthcare would be going. In my own grief, so at that time I was left with 2 young daughters to raise by myself. So in my own grief, in my own dark times, struggling with suicidal thoughts, where am I going to go? How am I going to get through this? What does my future look like? I can't imagine in those moments, instead of talk therapy, trauma care, that I would have been met with death as an option, and leaving my children and family in more despair. And so in my 16 years, I've deepened my own learning. I studied trauma therapy with the Crisis and Trauma Center of Alberta. I've learned more about nervous system regulation and somatic care. And then I deepened into massotherapy. And in the last few years, I began working with women who have gone through their own despair, and understanding that when we are in crisis, our prefrontal cortex shuts down. We don't have access to reasoning. And so if you're in a position where you're facing doctors that are pushing euthanasia and you cannot even think for yourself what is the truth of the reality of value of life, while euthanasia is just a means to eliminate hope. And so my purpose is really to be there to show that on the other side there is hope, and there is love, and there is community, and that is what we're here for today.
Thank you very much. Was there okay. So in conclusion, and it's 101, so it's about time to have a conclusion. When we started seeking stories, I got a plethora of stories from people who would say that when I was at my dark time, when I was going through the deepest, darkest time of my life, I wanted death. And if this were legal for me at that time, I probably would have asked for it. And if I had qualified, I would be dead. So people go through these times in their life. And there was many stories. I can, we have that website that we had set up with this, and also for my blog. I got an email from a woman who talked about when she was 17, how she was so down, she was so depressed, she could not see past where she was at, and she had attempted suicide. She wanted to be dead, and at that time in her life, they said that she had a type of an irremediable condition, because this had gone on for several years. And she wrote this to us saying that she probably would have qualified, obviously a little bit later because she wasn't 18 yet, but then she said, then, when she got into her 20s, something had changed. There had been some treatment, there had been help, but also her life had changed. And she met somebody, and she fell in love, and she got married. And when she was emailing me this, I can't compete with the truck. The truck's louder than me. So now the truck's, she said, so when she was sending me that email, that would have been about 6 months ago at that time, so she would have had her baby now. She said, now I'm pregnant, I have a new life going on, I'm so happy to be alive, but at that time I could have never imagined being here today. And you have to think about this, is what we're talking about. When you lose your life to euthanasia, you're dead. You can't come back. It's done. There's no, nothing else beyond it. So we need to sell hope. We need to sell vision of life is worth living. So we need Bill C-218 to pass, but that's just the beginning point. We need a reversal of this craziness in our country. And the only way that's going to happen, is through people actually coming out and talking about it. We need more stories from people who've gone through these situations and are now happy to be alive. But we also need the stories from families such as Margaret Marcillo, who suffered so greatly after her son Cano died. She called me on January 3rd saying, I've been told Cano has died by euthanasia. She didn't believe it, actually. They contacted the police at first. They're from Ontario. He flew to Vancouver to die by euthanasia by Dr. Ellen Weeb, because she had approved him, doctor shopping. He was dead. At first she didn't believe it when they got message. It was actually her daughter that received the message. So Cano had actually told the police, tell my sister. So she found out on January 3rd. So they called the police saying, we got this message, we don't believe it's true. And on January 4th it was confirmed. So, but she called me on January 3rd and she was broken by the death of her son. Think about this, he was 26. And as she said, you know, he had gone through a lot of depression, a lot of mental health issues, seriously. And he was so deep into it, he often wouldn't be able to see it. He would say, Mom, you're the one with the problem. This is how he would talk to her. Mom, you're the one with the problem. And she just wanted him to have help. Anyway, the point is that she kept on saying to me, I always thought, but you know, in a few more years, maybe he'd be coming out of it a bit. But of course, he's dead. You don't come out of that. So this is where we have to recognize it comes from our talking about it and telling the stories that people will start changing their mind. Because the concept that this is all about choice, autonomy, freedom, that's a lie, and a lie. It's not about choice, autonomy, and freedom. It's never about autonomy when someone else kills you, right? It's a choice when someone's going through the deepest, darkest time of their life. And I'm not questioning that people suffer. We're human beings, so yes, we will go through suffering at times in our life. The response to suffering is to care. So that's also a challenge to all of us. We must recognize that when somebody we know in our church community, our neighbors, or someone we know who we grew up with and we've been in communication with a little bit, we know they're going through a difficult time, as a human being, they need you to be present to them, because that's how we need to be. When you're alone and you feel abandoned in the culture, then you can see how the death culture grows. And we need to reverse that. So anyway, thank you for coming here. I know some of you came a long way, and I'm very thankful, especially since it rained, couldn't control the rain. Many of you sent emails to me saying you're coming. I'm hoping you all did come. If you didn't come, obviously you can't tell me you're not here. I mean, the point of it is that I was really pleased to see the number here, and actually looks like it's going to stop raining about now. Let's just hope for a better Canada tomorrow. Thank you.
Well done, Alex.
Okay, can everybody gather here? We get a quick group picture. Very fast. Very fast group picture. I need someone who's going to take a picture.
Might as well.
Can we get a group picture? Everyone gather behind quickly. You can get right next to me. You guys get next to me.